Right. Good afternoon, everyone. Welcome to the School of Public Service and Governance seminar. I think this, I'm not sure if this is the last of the for the year, but I'm going to look at the gap in the use of systems thinking approach for health practice in Africa. And this is not just the gap, but we did some form of needs assessment. And then I want to share the results with you. And also to share the next steps of what is happening. So I'll give you a little bit of background of this and how we arrived at this particular project. It's not a project, it's like an initiative. So this is the outline of my presentation. I'll give, of course, the introduction and background, and then I'll give you the objectives of both Systac and then the needs assessment, and then the method used for the needs assessment, and then the key findings. I'm not sure, I think this is supposed to be interactive so that people can react to and respond to the findings or the work itself. So I will try and do this within the possibly 25, 30 minutes so that we can have more time for the discussion. We also have some recommendations and then also what has happened since the needs assessment. Okay, so starting with the background information, which is also some of the intro. Basically, Systac, when we talk about Systac, we are looking, is a short form for Systems Thinking Accelerator. This is an Alliance for Health project, more or less like an initiative that is under the WHO and is seated in Geneva. And so there is a consortium of which CHESFO then was part of that consortium. And so GIMPA by extension is part of that consortium of various low and middle income country institutions to understand how systems thinking is being used, particularly among practitioners. This time, systems thinking in health or health systems is more or less very relevant. And we know that with the advent of COVID, it's become very apparent that, and it's very now common knowledge for everyone that you need to go the systems thinking way or approach in which you think about the complexities around issues that happen, and then also looking at the unit as well as having a broader perspective of what happens and how these influence activities or happenings within the health system. So systems thinking have become very, very relevant in that we saw that other sectors are relevant in understanding and the performance of the health sector. It's not purely dependent on the health sector. And for Africa particularly, it is so much the case in times of Ebola and now also in time of COVID, where we need to appreciate the role and the complexities, how things are interdependent and interrelated, especially if we want to have a functioning and also a responsive health system. So that is, and there was a book in 2010, 2015, and also written by systems thinkers that was launched by the Alliance for Health on systems thinking in strengthening health systems. And this book, which is more or less like a manual, became something that was highly downloaded across the globe. And so it spoke about thinking about systems thinking and how you apply these in various perspectives. What was interesting around it is that it did look at how a lot of researchers are applying systems thinking to bring that knowledge actually into the way they reflect on actions and performance within the health sector. Unfortunately, that is not translating into decision-making so much as it is not translating in practice. So practitioners, frontline workers, health workers who are supposed to reflect on systems thinking are not doing so. And that is why Systac was initiated, to create that awareness and also to see what the issues are and how we can strengthen the use of system thinking, particularly in practice and for decision making, and also as driving evidence-based decision. So that is the essence of this initiative. So the aim of it is that the overall aim of Systac is to increase the use of system thinking in practice, with the objective being to stress the importance on focusing systems thinking application to ensure that there is capacity for those who are meant to use it. And we'll see what the needs assessments have shown, particularly in the African context, because that's what I led. There are other needs assessments that were done in the Asian Pacific, and then also in Europe, and then also in South America. And all of these, not the main part of Europe, but Eastern Europe and some parts of West as well. So this has been done across various continents to try and understand what the issues are and what is unique in each of these different contexts. So I am focusing on African perspective and what we found when we did a needs assessment and who participated and so on. So this is basically to build platforms for systems thinking so that we can bridge the gap between research and practice as well as decision making, and also to kind of create some form of community of practice between decision makers, researchers, and practitioners, whom tend to focus on their everyday routine activities and think that decisions are made for them, but in actual sense, they are at the center of decision making. And then also to amplify the need for systems thinking, because most of the failures of health policies are because they are short-term focused. They are to resolve the issues now rather than to build systems that are resilient to changes, and also they are responsive to needs or various needs and changes in these needs. So these are some of the things that Systac is meant to advocate for, so far as we know where and how to do these things through the needs assessment. So like I said, the three key actors that we are focusing on in terms of the needs assessment is to understand the actors' needs, the key actors' needs. What is the need of practitioners as compared to researchers or decision makers? And then also to seek to understand the barriers in applying systems thinking, as well as the opportunities in doing so. And then also, I think there are some few people I must admit in, let me see. Okay, they are already being admitted. Okay. And then also where there is a gap in capacities or competencies of user systems thinking, where are these gaps and how can we improve on these gaps? Then the other one is to map out various actors, their interest and power that they bring on board, what is the opportunities that they have, and how can they, play a key role, and how should we engage them? To what extent should we engage them? So we did quite an extensive needs assessment in terms of looking at three key methods, using three key methods to do this. First and foremost, we looked at consultative workshops. Here we wanted to understand people's general understanding of what systems thinking is, what constitutes it, what tools are available to do them, which stakeholders are involved in it, what challenges or opportunities are there to apply these systems thinking in health broadly and also related sectors, and then also how Systac would function to support or build and improve use of systems thinking. So that was what we did for the consultative workshop. I'll give you details of it soon. Then for the stakeholder mapping, we did a stakeholder mapping, mostly with the people who participated in the consultative workshop. And the stakeholder mapping, we did it to look at who we found in the first consultative workshops. How do we validate these stakeholders and also classify them, the roles that they play, how do we map them out in terms of the gap assessment, and then how do we prioritize engaging them to strengthen systems thinking practice in Africa. Now, in most of these consultative workshops, I think in all of it actually, we also had a Zoom poll. These were done via Zoom. We also had a Zoom poll just to understand what people's knowledge of systems thinking is broadly in terms of health, and then also whether they engage with it or not, and what they have engaged with in terms of the tools. There was also a survey. The survey was mostly sent through our networks, particularly in the African networks, and then also through some of our alumni, and then also existing students, particularly GIMPA students that I was teaching at the time when this assessment was conducted. In fact, this was done earlier in the middle of the year. So it's not such an old data, it's quite a new data. So this is what we got for the stakeholders. For the consultative workshop, we had 77 participants, people registering to participate. And also for the consultative workshop, which took an average of about 2 hours, give and take. So if we had a small group of about 3 or 4, it took probably less because there were lesser people engaging. But if we had a group of about 5 or 6, it took about 2 hours, 2.5 hours, depending on how knowledgeable the group and how diverse the group constitution was. But it was actually, we had 27 people. And then we had people from different countries, Ghana, Sierra Leone, South Africa, Sudan, Botswana, Kenya, and Uganda participating in these various workshops, and then as well as the survey. Now, most of the time, like I said, we're using professional association, which is the health systems global associations, and then also networks like my teaching and learning thematic working group, and other networks that I belong to in the continent, like WANEL and so on. So we use that, and then also areas where I teach, like the alumni of GIMPA, as well as the South African Western Cape province, as well as the Legon network that I have, a School of Public Health. Also, we shared some of the survey with them. Unfortunately, participation in the survey was quite low. If you can see, we sent emails to 416 participants, but we had only 67 response, which is quite low, but it's a needs assessment. So we wanted to generally have a general idea about what is going on and what's the reality of practitioners, particularly as much as researchers were in the continent. So this, I'll go on to the findings. So in terms of the findings, particularly when it came to the consultative workshop, which looked at knowledge and also availability of tools and the use of tools, it was quite interesting. And some of the things that came up is that people have heard about systems thinking, because now it's a buzzword for health. People know about health systems thinking, or simply systems thinking, particularly practitioners who are at the national level and also the regional or meso level, in that most funding and donor or donor funding tend to want to promote systems thinking approaches where they have specific tools that they want to use so that there is some form of resilience or sustainability in the project that they are rolling out. So systems thinking have become, a buzzword. Then also, most of the people too have engaged with, have taken some form of short course training that would involve one or the other of these tools, as well as they have undertaken academic programs like MPH or epidemiological courses or training where they have been exposed to one or two tools. So some of these things have came out quite strongly. However, what was interesting in terms of knowledge is that people have different ideas and conceptualization of what systems thinking is. Please feel free to write your comments or questions in the chat box so that I'll present and then we can take it from there. And then also you don't forget. Okay, so some of these knowledge were different. So some people saw systems thinking as an approach to decision making or to doing research or to problem solving. And then others also saw it as a management tool. And then also others saw it as a research tool. Whatever the definition is, what was very common among most of these definitions is that most people identify it as a process of looking at complexity or identify complexity within a particular system, whether it is for implementation, whether it is for problem identification, or whether it's for diagnosis, or whether it's for the management processes. They realize that it actually helps to unpack the complexities embedded in these various contexts or settings. So it was very useful to understand that. But not everybody knew what systems thinking was. In fact, in terms of defining it. So others, in terms of the polls, some people said they've never heard of it. And then in terms of the discussions, we still had people who said they've never heard of it. What was interesting was that those who said they've never heard of systems thinking were people who were not in the core health sector, but we had some people from social welfare, we had some people from interior. So with those coming from other sectors, particularly social welfare, and they said they've not heard about it, which was interesting because you think by virtue of what they do, they should rather be using systems thinking approaches more. Then also we realized that there were more awareness among researchers. Researchers were very much aware of the tools that they were using, the various systems thinking tools that was available, as much as the use of these tools, because they used them for research, and for that matter, they had to have control over them or self-tutor themselves to know about it. And then they also use them to teach. So researchers more or less tend to know what it is. That was not the same for practitioners and decision makers. So practitioners mostly, few people knew about it, but we had a group of people who said, what do you mean by systems? Can you explain? Can you give us examples? And then after a few examples, they said, oh, we've used this for these processes. We've used this for that. And also, yet again, that was from the NGO and some practitioners within the health sector. So in that area, you realize that people were using it without even knowing they were actually practicing systems thinking or using systems thinking tools. So when we asked them to validate it, the most common ones, which some of us know as management tools or problem-solving tools, like the SWOT analysis and the rest, were things that were identified by the common health systems thinking tools, were only identified by people who were exposed to it through key projects or through their academic programs where they use it for assignments, but they didn't realize they needed to translate that knowledge into practice, which was also a very interesting finding for us. So in terms of opportunities, we realized that there were quite a lot of competences, especially when it came to training, and then also some form of informal support, where there was some form of mentorship or learning systems that are built in some departments rather than in whole organizations. So we also looked at systems thinking in practice, where we thought about, can you apply these systems thinking, or are you able to apply it in your work setting, whether as a routine or in the organization or at the departmental level. And we also saw variations, particularly in the opportunities for them to do this. So these were also some things that were very interesting to us. And I think I'll speak to some of these as I go along. So these were some of the common tools that were mapped out. So we saw process mapping, social network analysis. People have used them without realizing, especially those within the NGO and social welfare setting. Mind mapping were used by a lot of the process mapping, mind mapping, and concept mapping were very common, and outcome mapping were common tools that were used by researchers. Social network analysis, reflective practice, have been used by practitioners. Reflective practice, mostly nurses, doctors, because it's part of their training to reflect on what happened and so on. Then also the iceberg model, mostly in academic work, but people have not translated them. Then causal loop diagrams, not so much, but people have been exposed to them in academic programs and also in research. Soft systems have been used, but people have not really realized that. Enriched pictures as well as dynamic system modeling. Then these are some of the key ones that people were very familiar with. Fishbone, root cause analysis of various forms, stakeholder analysis, and then the SWOT analysis, which is very common. Photo voice is mostly new things that were coming up that some people have used in the NGO sector, as well as the think tank areas. So these are, okay, so these are things that that were new to them. And then video and documentary diaries. These are now things that are coming, short videos, short documentaries, and vlogs, and all sorts of things. So, and then quality improvement for practitioners, they use them a lot for various quality processes. So these are all elements that, tools that were common. Now, in terms of the survey, those are some of the things that came out. You realize that process mapping is the one that is most commonly known among the respondents, followed by iceberg model, reflective practice, and causal loop. But these people who said they had engaged with it had done so through academic processes, with very few people using it for practice, like I said, especially for reflective practices. Outcome mapping were mostly by the 5 researchers who said they have used it and they were very familiar with it. Rich pictures, even though the survey said few people have used it, in the, what do you call it, in the consultative workshop itself, people actually had to say, oh, actually, we also use it for something else. So it was very interesting for us to know that, look, there are a lot of tools that people are using without even knowing what they are or what they were doing in terms of the impact of it and the relevance in terms of long-term implication for practice and decision-making, which we thought this is something that was an opportunity that, you know, some of these things were familiar to them, except they needed to build their competences and confidence around using them. The other thing that we looked at is the benefit of user systems thinking. And I'm going to go back, in fact, to look at the systems thinking in practice. What we notice is that there were general views that systems thinking in practice becomes difficult because of the way the context within which most practitioners work is. For most practitioners, there is pressure on them to deliver, and so they don't have the system that supports this systematic process. And for systems thinking processes, these are systematic processes that require you to go through certain steps or processes in order to understand what are the hidden issues, the obvious issues, and probably sometimes the complexities within a particular situation or context. But the system that they run, mostly in the health sector, is under pressure. So you have mostly leadership that are not supporting it, or you have people who learn these things but come to a context that do not support application of it. And then you have one person who may have the knowledge working with a team of others who may not have the knowledge. And for that matter, trying to get them to come on board becomes a difficulty. And sometimes you also have juniors who have the knowledge, but their senior colleagues do not, or are unwilling, do not have the commitment and the willingness to apply it. So organizationally, what became apparent was that the context is not supportive. Then also in terms of routine, some routine activities require you to apply systems thinking, especially when it comes to strategic planning, and then also in terms of when you are forced by certain what do you call it, grants and interventions or programs to apply them. But otherwise, the routine requirement of the health system or the health sector itself is built under a systems approach, where your work as a records person fits into the nursing work, as well as the consultation by the medical officer, as well as the diagnostic person. It's a whole systems process, a chain of events that when there is a bad or an error in one aspect, affect the rest of it. And for that matter, overall quality and patient experience is affected. But applying it in reality is an issue. So in some contexts, applying this under that pressure becomes a problem, because the system, even though designed to do that, is not, by convention being practiced that way. And so it becomes a problem. And that we found quite interesting, that there is that gap existing in terms of systems thinking, which is why when the COVID hit, some of these things became so exposed and became such a problem for most people to address. Also, what we found as interesting was that at the organizational level, in theory, there is systems thinking embedded in most organizational planning and strategies. But in practice, organizational levels don't support. And I can relate to that, especially even within our GIMPA context, where sometimes you see the schools behaving as if they are competing for each other, whereas we are all working for one GIMPA, and you see departments saying, oh, these people and that people, whereas in fact, what we should be doing is harnessing and strengthening each other, and then building one, because we are all working for the same GIMPA. But that is what happens in most contexts where there is some form of competition among the departments. And so even though you have one department doing so well in terms of applying systems thinking, it doesn't translate across the organization as a whole, and there is always a gap in there. So I'm going to look at the benefits. Some of the benefits that we saw that people actually mentioned in terms of why we should be using systems thinking is that it's very useful in terms of harnessing resources, and actually not duplicating things that people are doing, and then also helping to achieve a broader aim and creating some flow and fluidity in terms of what is required. So you see where there is a gap in the chain, and then it's easier not to just pass on the blame, but to see exactly where there are challenges. So, but then, of course, due to the issues that I mentioned earlier, these things are not being applied, but they actually acknowledge that it's very, very important. And people said they were interested in it. They thought that there was the opportunity for institutional awareness, as well as some people were willing to apply it. When it came to events and trends that facilitate the use of systems thinking, most people identified opportunities that I mentioned earlier. One being in terms of capacity building, the other being even when there is leadership change, where you lobby leadership to be able to create an environment that enables systems thinking. Then also even some people went far as political changes. And then also there was the issue of thinking around having champions, people who support these kind of thinking to create some form of training and improve its application within organization beyond one or two departments or units that apply these things. There were clear challenges that were looked at, and I think some of them will come up strongly as I go along, so I'm going to skip it for now. So in terms of applying systems thinking, these were the people who said, yes, we use it, but what do they use it for? You can see majority of the people are researchers. And then also some few people said in routine application. I think about half of this is looking at each one and 100%. And then you realize that very, very few people use it for implementation or for practice. But management processes, some say, look, by virtue of the decision I need to take, yes, I'm forced to use some form of systems thinking to analyze the problem or to define my solution. In terms of recognizing systems thinking practice, by the organization, majority said, well, we do recognize systems thinking is important, but then not necessarily applying it. In terms of by managers, yet again, yes, is the case, but not. But in terms of routine, majority of the people say yes, for our routine work, we recognize it. In terms of what benefits there is, you see that 100% of the people said it's quite useful for health systems issues to address it. And then also some about 2/3 said, look, it helps us to steer the strategies as well as projects and programs or intervention. Whether at the institutional level, there is some level of awareness. There is a high awareness within the institution as a whole, like I said, as compared to the whole organizational level. So that itself shows you, even in the survey results, where there is a gap in terms of these differences. So for us, some of the things that came up in terms of what Systac can do to support, or what the needs assessment shows, is that for the African context, systems thinking in Africa will require some form of tools and capacities. And I think I would unpack some of these as I go along. For capacity, we think that there is the need for training people in systems thinking. And these trainings shouldn't be individual for obvious reasons of what I stated earlier. So we need to train people in building their capacity and their competencies, but training should be based on team training. So you don't go and you are talking to yourself where others don't understand things, or because if you think you're going to do MPH, you are being too, no. We want people to appreciate that, look, this is the way to go. And for that matter, let's put these structures in place and let's see whether this cascade down to other units or sectors. So also, we need to also appreciate the interdisciplinarity of the health sector, which involves a multi-sectoral approach, using the COVID as a springboard upon which we can harness the strength of interdisciplinarity and intersectoral approach to health. So we saw this as an opportunity for us to strengthen that. Then also we thought that for the tools, there are so many tools, and these tools are already being used for various things. So we can still harness and strengthen the use of it when it comes to planning and designing or executing and evaluating of policies, intervention, and decision-making. Then also mapping these for root cause analysis, and also making sense of various situations and contexts that people find themselves in, and also appreciating the complexity associated with the health sector broadly and other sectors that work closely and related to health. I also think that there were other issues in terms of what it implies. And here we are looking at, it implies person-centeredness when it comes to strengthening of systems, the gap assessment, evidence generation, and evidence-informed decision-making. Once you have this knowledge, it helps to do that. And by doing these things, it helps you also to understand that, look, decisions and health systems is better if we think about it as person-centeredness rather than programs and interventions and focusing on decisions and rather than the gaps. So we need to look at the community participation as well as inclusiveness. And by that, we'll see where there are quality and effectiveness gaps, how we can have harmonize various programs, and also try to look at the complexities involved. Issues around equity and accessibility can also be addressed. We thought it creates or presents clear issues of opportunities and challenges. And for us, it presents some of these challenges when it comes to resistance to change. There are a lot of people who are resistant to change. And the system, even though it's built to support change, still it is practiced in a way that makes it, by convention, resistance to change. There is also issues around political will and commitments, and also administrative barriers. Institutional, there is no transparency in terms of the institutions and how they do things. And then also there is some form of demotivation for those who are willing to apply systems thinking. With regards to opportunities, like I said earlier, there is opportunity to empower people to participate, to integrate multiple sectors. And then also, so for instance, if you take something like WASH, which is the Ministry for Water and Sanitation, most of the things that they do have implication for health. There's no reason why they shouldn't harness their strength and how they do things, because WASH translates in each of the health facilities and each of the intervention, because, and today with COVID, we see that very clearly. So you need to look at how we can generate evidence of how these things must be done to enable extend the use of the little or limited resources that we have on the continent. Then also with regards to some aspects of the harnessing of resources and also integration, we thought that it's the systems thinking allow for broadening of perspective, understanding of the complexities, and also how the role of public-private sector versus public third sector, and even sometimes all three sectors, how they interact and what that means in terms of supporting the health sector, as well as the important role of socioeconomic and political structures. So I want to quickly show some of the stakeholder analysis or mapping that we did, and also say that we did this looking at the priorities as well as the system. This is a very complex. We use mapping relationships in what we call XMind. So we use XMind to map out all the various. It's so small you can see them, but this will be available soon. We are writing up this into an article so that we can publish it, and I think it will be available soon. But as you can, those of you can see, I'll probably enlarge it a little bit. You will see that there are various sectors that came out. Using the COVID as the intervention, we realized that the role of other sectors was very, very important. Okay, this is stuck. Okay. Oh, sorry. So yet again, when you look at the role of the health sector, even within the Ministry of Health as a sector, there are so many various agencies that play a role, and you can, as we unpack them, it even becomes even more complex. Okay. So the final outcome of the stakeholder analysis is to look at how we can prioritize key stakeholders and who we should prioritize and what we should do with them. So this is the matrix that we used, where we identify key stakeholders, in fact, within the health system broadly. And we thought that some of them are very important, especially those in the right corner of your screen, which is those that we want to manage closely. Some of them, their role is relevant, but they do not have active participation. So we thought we should keep informed. And there are some we just have to monitor them. And there are some too that we need to keep satisfied. And these are the various classification. But we thought those that we need to manage closely are these for systems thinking to now become a routine way of doing it for sustainability, because we see it is a big problem in Africa. So in Africa, most of the policies change so much because we rely on donor funding. We are not our own people. We don't take decisions that are sustainable. So sometimes we even duplicate, and most of our policies are short, and interventions or programs are short-term without any sustainable plans. Even if there is, we can really put them into action. So we thought some of the key actors here need to be informed. What was interesting is that there were certain actors that we thought should kind of appear in all these four segments, which is mostly politicians and community members. With somehow they appeared in all, they need to be informed, they need to be monitored, they need to be kept satisfied, as well as they need to be managed closely. So it's interesting to note that some of them are, important. So to summarize, these were some of the things that came in strongly in terms of the qualitative findings, that practitioners are aware of systems thinking, but more of researchers than practitioners. They are not really aware of, and they are not capacitated to know what is included in it. Then also, knowledge of it is useful, clearly, because they said it was very important. And there was also differences in terms of practice of it, and also differences in terms of systems thinking application within departments and organization as a whole. What was interesting, that there will be an additional, an additional, I'm doing another webinar in March. It's a global webinar though. In March, it's looking at how we can use politics, we can strengthen politics, or try to get political will for systems thinking. So here, what we saw strongly for practitioners is the failure in leadership to appreciate systems thinking. They think that it is one of the biggest problems, that because if your boss don't, hey, go and do as we said, look, the politician is on my neck, we need to get results. What are you talking about? That kind of attitude we need to target the right people. Then issues of context, creating an enabling context is also very important. And these are just some of the quotes in terms of opportunities. So in terms of gap, we saw gap in various areas: leadership, decision-making practice, for collaboration, for accountability mechanisms, sustainability funding, and so on. So I'm going to stop here for questions. Just to say that there are some recommendations that were made. These are some of them: creating awareness, advocating, like I'm doing now, networking, building capacities, and actually having champions. But we've done some things to promote this already. We've done 3 global webinars. We've done 3 regional webinars, particularly in the Southern African region, not South Africa only, but Southern African region. We are building more for next year in Botswana and Sudan, and then also in Ghana. But because we don't want these things to kind of clash, we want to harness some of these webinars so that people can benefit broadly. So we are not going to be doing them concurrently. We are going to probably target and support this. We are also working with the Health Systems Global Teaching and Learning Thematic Working Group to support capacity building. And then we had some form of mini conference recently to already share experiences from various continents across the globe. So there is a hive, what we call the Alliance Hive, where we are asking people to sign up. We are going to create a community of practice in the African region and have our own section in the Hive, so that we can actually promote systems thinking. So I'll stop here. No more talking. So please, I think I'm open for questions. Chair, over to you, please, if he's still online.
Hello? Hello?
We can hear you.
Okay. So yes, time for questions. Yes, any question for the presenter, please? Okay, presenter, I think I have some comments that I shared in the chat. If you can look at them and respond to, whilst we wait for the other participant to come with their questions.
Okay. So I think you had one question that says, any reason for stakeholder mapping distribution?
Yes, I think the distribution.
You mean the number, the 27 participants?
Yes, I saw that. I think Ghana was about 80-something%.
Yes. Unfortunately, there was an issue with timing. The what do you call it? The time difference across the continent. So most of the people that participated in were from Ghana. And most of them also were practitioners. But then we had some mostly drawn from, we had one from Sierra Leone, South Africa, Sudan, and then we had one person from Botswana who participated in the stakeholder mapping, I think. And then, but it was something that was time consuming. And then we also had one of the biggest challenge, I think I missed presenting it, of this work is that almost everything was done online. So we had issues for people who had low bandwidth or internet issues. A lot of the people dropped off in the middle of the activities that we had, like the methods, if it's consultative workshops. We had a lot of people. It was people, surprisingly, those who stayed were people who were really interested. So they wanted to engage and kind of, so those 27 were the people who really stayed throughout. But we had more people coming in, except they couldn't stay on. So we didn't count them as participants fully. So that is what happened. And most of the people were the Ghanaians. So I raised that with the Alliance group, but they said, well, we wanted to know what was pertaining, which we understand there may be contextual differences between what is happening in DRC, Congo, for instance, or Sudan versus Ghana. But most of the issues were kind of similar in terms of application, apart from South Africa. Even in South Africa, there were also differences across regions. So that was something that also came out quite strongly.
So
then the second question. Okay, go on.
Okay. Yeah, so I just wanted to follow up. So meaning that to some extent, the findings that you are presenting to us will be more biased towards the Ghanaian setting.
For the stakeholder consultation, yes. For the stakeholder, trying to map out the stakeholders, yes.
Okay.
Yeah. So it shows, but we realized some complexity very quickly. The actors were similar, except for the names. So for instance, if we talk about transport or Ministry of Transport and Highways, we have Ministry of Highways in Ghana and Ministry of Transport separate. But in Sudan, what we notice is that they are the same. And then we had different classifications. So what we had to end up doing was to look at them as sectors. So the stakeholder mapping clearly very, very biased towards the Ghanaian setting.
Okay.
Then the second question that you had was, I noticed there were 3 data collection techniques that were employed. What am I not sure of? Is the data. Which of these data sources are informing the results? So all three of them informed the results. So some of them were qualitative. The consultative workshop was qualitative data because we were asking them questions and people were sharing their views. But then the survey is the ones that we quantified. So the last minute, some of the quotes I was showing you were some of the qualitative. So in the full report, we showed both the qualitative data and whether it supports what we found in the qualitative narratives, and then we saw whether there are similarities in those findings. What we didn't use or include, which is why I just mentioned them, is the polls. We didn't use the data, the results from the polls. We only use it to understand where the people were, to shape the way we ask them the questions and to see whether there's a difference between their response and what they filled out in the polls. So that one, we didn't use it to analyze for the data, but we used it to kind of do the discussions. So that is what we did. And we also use it for the consultative workshop and not the mapping, because the mapping, almost everybody in the mapping had participated in the consultative workshop. I hope that helps clarify your question.
Yeah. That's fine.
Okay, then the third question is, I would love to see more explicit presentation on findings. Show, for example, gender disparity as well. Oh, we have that. We have the gender disparity. I can show you the report if that's possible. We have that. Let me just quickly consult it. There are a whole lot of detailed demographic analysis of who participated from where and so on. Except I was focusing on more of the findings that we had. Let me see. I need more clarity on the I don't understand your question on 4.
Okay, so basically I understand this system thinking to be some kind of a new intervention, right?
Sorry, yeah, go ahead.
Yes, so I said, if I understood you, correctly, so this system thinking is more like an intervention that is being actually, proposed. Basically, if I'm right.
Not really, actually. It has been in existence for quite a while now, at least for the last 2 decades. Systems thinking have been in existence, but it hasn't been used so much, and people are not aware of the systems thinking as a default way of doing things. But it has been around for a long time. So what we are doing is that with the COVID, emphasis has been on how do we, should I say, navigate the various areas or sectors, and how do we see how they are connected, and how do we manage them to be able to make sense of what we are finding, what is happening, where we should, put in some form of intervention. So it's been there, but especially I think for Africa, with Ebola to start with, systems thinking became one of the important things that was being promoted by donors. But with COVID now, it has translated to, it is a must kind of thing. So it's already in existence. But we want to revive it and say, look, this is the way to go for sustainability, especially if we want to be self-reliant, and also if we want to be able to manage our own health systems.
But you don't think going through this systematic way of doing things will introduce a lot of bureaucracy into delivering of health services, or dealing with issues?
Okay, so it's a yes or no answer, and that is the reason why, even though most of the routine way of doing things for health practitioners involves systems thinking, that is some of the excuse for not using it. But then if you look at the I don't know where you studied. Did you study in the US or the UK or where? Where did you study?
In Scandinavia, in Sweden.
Okay, so if you look, probably, I'm sure it's similar because our colleagues that presented from the Geneva were similar. It's not the same as Scandinavia though, but you realize that the health sector or the health sector is built on systems. So you follow protocols, you follow processes. Decision making, in the UK, for instance, they have the white paper, the green paper, and then you look at how the Department of Health decisions are embedded in social welfare decisions and how they relate to each other, and then how they are embedded in technologies and how they relate to each other and how they support and how the budget itself is taken into consideration, so that budget given to, let's say, environment, will take into account the implication of that budget on health, or the health budget on environment, because the mess of environment is picked up, the health mess of environment is picked up by health. Similarly, community budgets, how do they support? So it kind of, these things are things that once you put those systems in place, and it's the same thing in South Africa, when you put those systems in place, they function naturally and they become a way of living. But this is the case where, because of the changes in our political system being linked to or translating into our organizations, and then also the fact that we rely on donor funding, and donors want accountability for the monies they've given, we don't even look at how maybe one program has implication to other programs in one same health facility and the same community. So system thinking helps you to look at all the other sectors of it. And so there are more advantages than disadvantages. And systematically doing things can become a way, but it takes time to set the system going. Once it starts going, it becomes easier and you know.
Okay.
Okay, is there any other question? Let me see if there's anything else in the chat box. Okay, there isn't. This is becoming a mono, or should I say a dual conversation? Is there any questions from anyone else?
Yes, please, participants. Please, we need comments from you or questions. Dr. Kwasi, are you there?
I think it's a nice presentation. I enjoyed the scope of the presentation. It covers many countries, and that is a very great job.
Dr. Frimpong, they say you should ask a question, not comment the presentation. Ask a question.
That's a comment. It's not only that you criticize people, you know. If there are good things,
but asking questions is not criticism.
Yes, of course.
But I like the coverage of the presentation.
Yeah,
especially many countries are involved, which gives some sort of collaboration there, which is good. And I think we should be heading towards those directions by doing international collaboration and international research. So I love it. I love it. Sincerely, I love it. I don't have anything to say.
Okay.
Thank you, Dr. Frimpong.
Dr. Furua, you've been with us throughout.
Oh, no, I dropped off actually.
Oh, okay.
But then, okay, I was, you know, but just as Dr. Frimpong said, I was actually making a sort of some light fun, but it's quite an extensive research. I think there were two questions I wanted to ask, but you covered it in terms of the proportion, the numbers of the sample from the different countries. And then I think those were my concerns. But I'm just thinking of how I could also use this in my own life, yes, management and then personal life. So I think it's fine.
Okay. Dr. Jenna, maybe I'll be So I mean,
but Delia, I've seen a question in the book. Delia has a question about the ethical implications. For instance, you were using students. You said you were using students, you were teaching and all that. Did you encounter any ethical challenges?
So
how did you address those challenges?
Okay, so we threw an invitation to them to participate, just like we are doing on this webinar. So we threw an invitation. We said we are having this. Would you be interested to participate? So in fact, in actual sense, we had about 6 or 7 students that participated. They were interested in it. Not everybody. It wasn't like I went to the classroom. No, it was an invitation. We used the alumni because they were all practitioners in the health sector. So we thought it was a very useful source of network that we can throw an invitation to. So we invited them to participate in our consultative workshops online. And then we invited them to also, initially when this was designed, we designed it to do a face-to-face, but with the COVID, and then also considering that we needed to get the view of everybody else, there wasn't any money involved so much. So it wasn't like I was going to run around when there's no money in it. So we just said, okay, we'll do this online and try and understand. And it's also because I was particularly interested in systems thinking issues. And also it's one of the things that I try to promote when I teach. So it was very listen. As you can see, I think you asked about the gender composition. This is the gender composition. And surprisingly, it was 44-56 when it came to in terms of, which one is this one? Yeah, the stakeholder mapping, it was almost balanced. There was a different gender composition when it came to the consultative workshop. We had more males, 65-35. We have more males than females. So overall, there was more males than females if you add all the data together, as well as the survey. But it was basically purposive invitation, and then also people came on board. Some others told their colleagues to come on board and also participate in it. So that is how it was, more or less like a snowball and purposive sampling.
But Gina, okay, Dr. Adom, please, I raise my hand. I don't know whether
Okay, please go ahead.
So Gina, please, I think that for me, this appeared to be sort of technical. That's how I think. Some of us don't know much about these things and how to use them. How did you, for instance, if I'm doing something on, I think the first I'm doing something, or I was doing something on neoliberalism and all that, I had to sort of do a presentation to participants to understand what the concept is. So how did you get your participants understanding all those technical things we're talking about before they were able to indicate whether they have been using it or not?
So in fact, there was one consultative workshop that I had to give 15 minutes description of every single tool before they said, oh, I know this. Oh, I didn't know this. So
yeah, that's what I want.
Most of the time, the poll, that is the relevance of the poll. The poll discussion was like an icebreaker. So before we started, we asked them to fill in the poll, which was, I think, 7 questions or so. So the poll will list the various, have you used any of these? Then they will just, it's a shame we couldn't download the poll results for each of the sessions. If I was very hectic within the 3 weeks or so that 4 weeks or so that we did this, because we had to do twice in a day to accommodate for different time zones. So what happened is that we asked them to fill in the pool. So some of them say, I think I'm familiar with this. So for the nurses, they do a lot of reflective practice. So they knew it. You understand? And then for the researchers, they knew some of them. Those who did MPhD, some of them said, oh, I know it. But then for one group, they said, look, can you describe what each of these things are? And I had to describe, kind of give a quick summary of what each looked like and what it's used for. And then most of them said, especially the social welfare and the MPhD was, we use this a lot. Oh, we use social networking a lot. The NGO said, oh, social network is the key way that we, for mental health, we identify the key people and so on, who, you know, and we trace families and so on. So some of them use it without knowing. And then others also are very much aware that they are using it. Then I had someone in Sierra Leone saying, look, as for me, the project required me to use it. So I had to go and self-tutor. There were quite about 5 people in the whole project that said they had to self-tutor. They have to go and learn about it themselves so that they will be able to apply these tools in their research and programs. But the reason why it was easier for my MPA students is that I've taught them most of these tools. If you've done 2 of my courses, because it's so relevant for health systems, I've taught them most of these tools, not all of it, but most of these tools. So they are familiar with it. So those who came on some of the courses, even whether short course or and the academic programs, are exposed to at least 3 of the tools that were listed. And others have used them as management tools anyway. So that is why we didn't really go through ethical process, because this is just a needs assessment to understand what the need are for the continent. Even though if we have to publish, probably issues of ethics will come in, but it was self invitation. Are you interested in doing it? Yes, then join and let's do it. Than actually trying to do a whole pure research around it.
Then Gina, then it means that it was also, you also use convenience. Did you mention that?
No, I didn't. But
because then it's more of convenience. There's more of convenience sampling. All right, thank you.
Thank you.
Okay, so I mean, maybe my last, so I mean, going forward, I mean, how do we implement this, especially within the Ghanaian context? I mean, what, you know, I mean, has to be right, you know, to have such a system, you know, functioning properly?
So that is where the recommendation is, where I didn't spend a lot of time telling you. These were the recommendations. Can you see my slide still?
Yes.
Okay. So this is what we recommended, and it's also similar to what was recommended in other regions. Okay. So what we realized was that there was a need for continuous empowerment, or just simply awareness creation around systems thinking tools, so that people know that they are using it, and then to advocate more for people to create a system that supports it. You see, even if you learn about something and the environment doesn't support, we know we work in GIMPA. I think GIMPA needs more systems thinking than any other health organization, to be quite honest. Because sometimes you go to, maybe, I don't want to put anybody on the spot, but you go to other departments or units, and it's like we are competing with each other. And in other departments, you don't even engage with others at all. You understand my point? Yet there is the need. So we saw that awareness creation of systems thinking would create some form of empowerment for people to use it. We thought that there is a need for us to advocate more, and also mostly create some form of leadership role who will appreciate the use of systems thinking and that will be committed to using it. But we can't only target the leadership, because leadership will not have time to apply it, but leadership will appreciate that decisions and also processes must follow these systems thinking approaches. And for that matter, they must also have champions, what we call systems thinking champion, across sectors, especially sectors that require it, and also build capacities, either in short programs, also embedding it in short training for organizations, or even academic programs. And then also, but we have created a community of practice but at the moment, we only have a global community of practice. Next year, we are going to have a big conference around promoting systems thinking for practice. So networking and building mutual support for it is very important. The other thing that I think is very important is having political support for it. Political support that we are not only looking at practitioners, but decision makers. So political support is not just politicians, but decision makers in key areas to support systems thinking, because they would actually ensure resources are available to create enabling environments. They will ensure resources are available or interventions accommodate these systems thinking processes and approaches. So we thought that is very important. This is why we are trying to even target donors that, you know, in the conference, one of the key things we are asking for is that donors should make it a part of health grants, whether for research or interventions or programs, that look, each of these grants should look at other sectors and make it key that you use interdisciplinarity, intersectoral approach, as well as systems thinking tools or approaches, so that there is some natural way of thinking around those interventions that is not devoid of the context within which they are implemented. So these are some of the things that we recommended from the research. And it's not just the output of the research, but actually participants said this will be some ways to go.
Thank you very much. Please, are there any further comments? If not, I'll give my closing remark. Any other comments?
Okay, so just the last one. Because of the size of mostly these recordings, I'll be on campus on Friday, so I can share that on a pen drive or something for you. Otherwise, I don't know. I could share it on a Google's I don't know if there is any way of sharing it with those who would be interested in having.
Yeah. Maybe we can use a Google Drive or something.
Yeah.
Okay. So, Dr. Jenna, first, we want to thank you for availing yourself. I think first, on behalf of the committee, let me apologize for what happened last week. But I think what is more important is that we've been able to have this presentation done. And thank you also for the participants. So next week, I think we are breaking this week.
Friday.
Yes.
Friday. So it means there shall be a continuation after the break, that is from 10th. So please keep alert, to your emails on that. And please let's all do well to make this faculty seminar, a success. So on this note, I want to thank all of us who were able to come, and please let's continue to spread the news to those who could not, attend. So thank you.